A lot of us are so disconnected from our true selves, such that even when you're coming to therapy to get help, you're getting help for the disconnected part of yourself, not your true self. And here's a quick example I can give you. A person comes to therapy complaining that they're procrastinating a lot more lately and it's affecting their productivity. And so they're worried they could lose their job. And so now they even have some anxiety symptoms, not enough to qualify for an anxiety disorder, but it's making them a bit uncomfortable. And so as a therapist, you have to first evaluate what they mean by their procrastinating and a lot more, meaning you have to compare the past and the present. And so in your assessment, and you have to be very thorough, you notice that their procrastinating behavior is actually not very far from the average person. Their performance is actually not very different from the average person. And the impact that it has on their productivity is actually not even significant. You might even find that there's no impact at all. But to them, in their own assessment, they're procrastinating. And so once you're able to understand the full picture of what they mean by procrastinating, you might actually realize that their past self and their present self is no different. And the past year could be a year ago, 2 years ago, or even a couple of months ago. And now is no different. The work that they've been doing, the time that they've been spending on different tasks is actually the same. So the procrastinating behavior is actually not there, but the person believes that it's there. And so now you ask, how do you know that it's there? How do you know that you're procrastinating? And what you start noticing in their responses is that someone who is important to them at work, maybe a manager or someone senior to them, is no longer recognizing or noticing their work. And so before, they used to feel like they were doing things well because someone noticed what they were doing, someone was paying attention to them, someone was validating the work that they were doing. And so that made them feel like they were effective and productive. But now that that person is not noticing, then they feel like there's something wrong with them. And so now they're coming to improve themselves, to increase their productivity so that the other person can notice. They've made it about them. And so why they came into therapy is they thought they had a problem with procrastinating. But what they're finding out about themselves is that they actually don't know how to validate their own accomplishments. They don't know how to validate their own productivity. They depend entirely on someone else doing that for them. And so when they're not getting that, they start looking for problems in themselves to solve so that they can become more visible to the other person to be validated. And so you realize that they were coming in with this external part of themselves that they've created, only to come and meet themselves. And now you go back and you realize that their self-esteem has actually been very low, even growing up. And their upbringing reveals to you that they didn't grow up in environments that enable them or nurtured them to be confident. And so that's the issue that they're going to have to deal with in therapy, not the procrastination, because it's actually not an issue.